As a pharmacist, you're on the front lines of chronic disease management every single day. So today, we're going to break down a really practical, evidence-based framework for counseling your patients on obesity. We'll cover the actionable steps and, of course, the crucial medication insights you need to provide the most effective care. Okay, let's dive right in. First, we'll talk about reframing obesity as the chronic disease it truly is. Then, we'll walk through this fantastic counseling framework called the 5 A's. After that, we'll look at all the therapeutic tools we have available, do a deep dive into pharmacotherapy and those all-important side effects, and then we'll wrap it all up with the key principles for long-term success. All right, first up, let's establish the modern understanding of obesity. You know, getting this right is the absolute foundation for every single patient conversation we have. It helps us move way beyond that simplistic and, let's be honest, often unhelpful advice. So here it is, the first and most important shift in our entire approach. We have to frame obesity for our patients not as some kind of willpower issue, but as a progressive, relapsing chronic disease, exactly the same way we talk about hypertension or diabetes. Just getting that framing right can change the whole dynamic of the conversation. For years, BMI has been our go-to, right? But we all know its limitations are pretty significant. It often underestimates the real health risks, and it loses accuracy across different ages and ancestries. So what's really interesting now is this shift toward a much more functional and, frankly, useful assessment. And this is that new approach in action. It's called the Edmonton Obesity Staging System, or EOS. Instead of just looking at height and weight, it lets you stage a patient based on the actual impact of their weight on their physical, psychological, and functional health. This makes it so much more useful for guiding how urgently and intensely we really need to intervene. Okay, so let's move to the how of our counseling. How do we structure these sensitive but totally vital conversations? Well, Obesity Canada has developed a simple yet incredibly powerful framework to guide us.
And here they are, the 5 A's. This gives you a clear, patient-centered roadmap. It all starts with respect, by just asking for permission. Then it moves through assessing, advising, and agreeing on a plan together. And what's so important is that it ends with practical support, assisting the patient in overcoming barriers and making sure there's a follow-up. This is your core strategy right here.
So, once you and your patient have actually agreed on a plan, what's in the toolbox? What kind of interventions can we draw upon? Let's take a quick look at the foundational strategies. So think of management as having these 3 foundational pillars that support everything else we do: nutrition, physical activity, and psychological interventions like CBT. For pretty much every patient, these are the base. They work alongside the primary medical interventions we're going to focus on now, pharmacotherapy, and, for some patients, bariatric surgery. And now for the core of this explainer, the medications. This is where your expertise as a pharmacist is absolutely critical. This is where we ensure patient success, safety, and of course, adherence.
Here's a quick snapshot of efficacy for the main therapies. And what this chart really highlights is the evolution of treatment. While older agents like orlistat give pretty modest results, that jump to over 12% placebo-subtracted weight loss with semaglutide, it just shows what a total game changer the newer GLP-1 class has been for our patients.
Okay, so let's start with the lipase inhibitor orlistat. It's been around for a while, and it works locally, right in the gut.
Its mechanism, blocking about 30% of dietary fat absorption, directly informs our counseling points. The common side effects are all GI-related, and they're a direct result of that unabsorbed fat. So the key message for your patients is that high-fat meals are going to be very poorly tolerated. And this can actually serve as a bit of a behavioral reinforcement tool. And here's a key safety point you absolutely must communicate. Because it blocks fat absorption, orlistat can also reduce the absorption of our fat-soluble vitamins, A, D, E, and K. So a daily multivitamin, timed correctly, is essential.
All right, next up, let's look at the combination of naltrexone and bupropion, which works centrally on those appetite and reward pathways in the brain.
Now, the most common side effect here is nausea, but it's really important to let patients know this is typically transient. It usually gets better. Other key counseling points include monitoring blood pressure because it can cause an increase, and advising patients to avoid taking their dose with a high-fat meal as that can significantly increase drug exposure.
And this is absolutely critical. You have to screen for contraindications. Because of that naltrexone component, it is absolutely contraindicated in patients on chronic opioid therapy. It's also a no-go for those with a seizure disorder or uncontrolled hypertension. This is non-negotiable.
Let's move on to the GLP-1 receptor agonists. These have really become a cornerstone of modern obesity management, mostly because of their incredible efficacy.
Okay, so the primary counseling points for GLP-1s really revolve around managing those very common GI side effects. Nausea, vomiting, diarrhea. They're pretty much expected. Emphasizing the absolute necessity of a slow dose titration is the key to improving tolerability, which in turn improves adherence and long-term success.
You also need to counsel on the rare but serious risks. While the absolute risk is pretty low, patients should definitely be aware of the signs of things like pancreatitis. And here's a major red flag. Any patient with a personal or family history of medullary thyroid cancer or MEN2 syndrome should not receive these medications. Period.
Finally, let's zoom out. Successful obesity management isn't about a single prescription or some short-term diet. It's about building a sustainable, long-term strategy with the patient.
So what's the lasting message for your patients? It's this: we are managing a chronic disease together. This means we need to shift the focus from the number on the scale to real health gains, prepare them for that inevitable plateau, and really set the expectation that these medications are for long-term management. Stopping them will very likely lead to weight regain.
And that leaves us with a final thought. As this therapeutic landscape continues to just explode, especially with highly effective oral options on the way, the pharmacist's role as that key, accessible provider in chronic weight management and medication counseling is only going to grow in importance.